Good morning. The Chief Executive will say a few words before he takes questions. Chief Executive, please. First of all, last week at Shamshui-Po, there was this case of a suspected abuse of a 5-year-old boy leading to his death. I expressed great concern about it. I'm very sad about it too. This case shows exactly that we must take forward legislative work on the mandatory reporting requirement for suspected child abuse cases. We must complete the consultation and legislative exercise as soon as possible. I have discussed this case with the Secretary for Labour and Welfare. We agreed that we must proceed with the legislative exercise as soon as possible. I understand he's going to consult the relevant sector today on the details and the scope to be covered by the proposed bill. I hope he will complete the consultation as soon as possible and then table the relevant bill to the Legislative Council for their scrutiny. And also in the discussion with him, I mentioned that for suspected or for child abuse cases, there must be a multidisciplinary and interdepartmental effort. There must be relevant, suitable training and guidelines so everyone knows what needs to be done and how the guide should be executed. Secondly, I'd like to talk about the number of confirmed cases each day. Now, the number is hovering at about 10,000 each day, which is at a high level. And that means there are at least two risks involved and there are 2 points of significance. First of all, for the high-risk groups, there is a real threat of their life with such high numbers because here we're talking about the elderly, the very young, and the chronically ill. With the fatality cases, we could see that 95% of the cases involved elderly aged 60 or above. And also, the vaccination rate among the elderly population is still not desirable, especially for the elderly aged 80 or above. About 20% of them are still not vaccinated. The fatality rate for those who've completed 3 doses of vaccine and those who have not, you can see that protection is some 50 times higher for those who've had 3 jabs. So for the elderly, please do not hesitate. Please get vaccinated. And then for the very young, the risks are high too. From August till now, about 20 young children have contracted COVID, and they have serious conditions, and they had to receive intensive care, and in fact one passed away unfortunately. And then among the very young, aged under 12 or below, there are still 20% who have not been vaccinated. And for those aged under 3, some 80% of them have not been vaccinated. So we must act quickly and make sure everyone is vaccinated. And then from the experts' advice, especially the experts on my panel, we know that vaccination has direct effect in preventing mild cases from developing into serious cases and even deaths. So we need to take 3 jabs to have the desired protection. Please don't wait, because if you wait, you may end up regretting that decision. Now, we have such a high number of confirmed cases each day. That means, which leads me to the second point, that means that the hospital authority is facing an immense burden. You know, the hospital authority has already the need to curtail 30% of non-essential services because of the high number of patients being admitted every day for COVID treatment. There are some 2,800 COVID patients now in HA hospitals. So by curtailing non-essential service for 30%, it means that some surgeries could not go ahead, some treatment could not go ahead, and there is also a staff shortage. So with a high number of confirmed cases, we're not just talking about just a number, but rather it poses a threat to the lives of the high-risk group, and also it is an overwhelming burden on our public healthcare system. That's why we need to work together to minimize the risk of transmission in the community. So for those who violate our quarantine requirements, we will take these cases most seriously. We have stepped up enforcement. For example, in the past week, the police have caught 4 persons who violated their red code. In other words, they should be staying home, but they were being irresponsible, and it is unacceptable to us because they went into the community to spread the disease. That's why we have taken action. We have sent these people to the isolation facilities, and also we would be prosecuting them in accordance with the law. And also, there are others who have violated the vaccine pass. We have also stepped up enforcement action in the past week. In the past week, 7 persons were caught violating the vaccine pass requirement. They've been issued summons. And then for our enforcement actions in other areas in relation to our prevention and control measures under the cap 599. There are various measures, and in regard to those, we have issued some 650 tickets and prosecuted some 50 persons. So we hope everyone will fully comply with our prevention and control measures. We will be actively inspecting both premises and individuals to make sure that people comply with our regulations. And also, please do not wait to get vaccinated. The best protection is to have 3 doses of vaccine. Any vaccine is good enough. So please do not hesitate, otherwise you will regret that. Now I'll take questions. Okay, the floor is now open to questions. If you are called upon, please use the microphone we give you to ask the question. And also, please identify the media organization you represent first, and please limit yourself to 2 questions each. On the left, in the front row, the gentleman in white. I'm from the Hong Kong Economic Journal. Good morning. Now, every day we have over 10,000 of new cases for 3 days in a row. But then there's people are asking the government to relax the various rules, in particular, reducing the number of quarantine days. Now, given the current situation, does it mean that you shelve the plan to change the quarantine rules to 2+7? But then in November there will be the rugby, and people are worried that these activities would be affected. So for players, rugby players, and others coming to join the financial summit, will there be special measures for them? Now. And also, you're not tightening measures as stringently as before. Does it mean that there is a change in your philosophy in fighting the epidemic? And then for EXCO members or the Directors Bureau, though there's a report, for example, that Professor Lo Chong-mao does not agree with you on certain points. So could you clarify that? Now, for our COVID policy certainly is for us to have regard to the actual situation and then make a decision. We look at data and the actual situation in Hong Kong in deciding what measures to roll out and what policy to adopt. I've said many times that for the SL government, there are 5 principles we go by. First, we won't lie flat. We will control the number of infection cases. We will make sure that our public healthcare system could cope. And second point, we want to reduce the number of serious cases and death cases. Thirdly, we want to focus on the high-risk groups, the old and the young, and also the chronically ill. We need to give them protection because their safety is because they're the most vulnerable. And fourthly, we will use targeted approach to target different groups, and then we'll adopt different measures to control the risks imposed on different groups. So that's why we have introduced various different measures such as the red and amber code system, vaccine pass, and so on. And fifthly, we will balance the risks of infection and the needs of the community to go conduct day-to-day activities. So on these 5 principles, we will roll out various COVID measures. Now, on what we are going to do in future and what measures we may have, we'll have regard to the actual situation of the epidemic in making our decision. But then there are a number of factors that would help us handle the epidemic. Now, I mentioned the 5 principles. The first one is to protect the high-risk groups, the young and the old and the young and the chronically ill. For them, the best protection is vaccination. So that's why I said that, and I appealed to the public that you must get your 3 doses vaccine as soon as possible. Second point is that we try to have precise management by different groups. So we have various social distancing measures, and they're based on our risk assessment. And then we roll out policies and we execute various measures accordingly. Now, based on these 5 principles, so for our various risk epidemic control measures, there will be changes from time to time. So we're going by the principles I've laid down, and you may think that's the approach is different than that for the previous government. But anyway, when it comes to fighting the epidemic, the ruling team of the Hong Kong SLG stays united. Now, of course, we will discuss issues, we will consider the pros and cons. But then once we come to decision, it will be executed by all in the team. Now, so with any policies, actually this is the principle we go by in this government, and then the team is working well together, and there is a good team spirit. So I hope you would appreciate that there would always be, extensive discussion before we formulate any policy. The principle is that we want to achieve the biggest the effect with the smallest price. Next, please, over there. To the left, the one in white, please.
From RTHK. So is the government considering a change in the quarantine measure to a 0+7 in November, when international events such as the Rugby Sevens and the summits are held? And also COVID cases have exceeded 10,000 for several days. And in light of the situation, will classes be suspended, and will social distancing rules be tightened as well? And also, Hong Kong Committee on Children's Rights has earlier expressed concerns for children's rights and welfare because unvaccinated children will be banned soon from entering premises like restaurants, swimming pools, and libraries, because the government will extend the vaccine pass to children as young as 5. So what do you think about this? Thank you.
首先，剛才問嘅0+7同埋
Concerning the 0+7 quarantine period, as well as the question asked by the English reporter, I will answer them in one go.
Government is contemplating and enforcing, we take into consideration 5 principles, which I have been explaining every now and then. I reiterate them. First of all, we will not lie flat. We will be striving to reduce the number of infected cases so as to ensure that our medical service can cope. The second is we will try to reduce serious cases and death cases. We will strive to protect the high-risk group, including the very old and the very young, and also those who have prolonged diseases. And we will be enforcing measures using methods of precision so as to differentiate people into different risk groups and design the measures according to the different levels of risks. And we will balance the risk against the need for normal social activities and economic activities. And based on all these factors, we will design our measures. So in regard to what we will do in future months, as regard the number of quarantine days, we will have to assess it based on the number of infected cases and how the transmission will be happening. We will have to make assessment, and when we make the assessment and come to a conclusion, of course, we'll make an announcement. I have said that one of the main principles is to protect the very young, because just this month we have about 20 cases of children actually suffering from serious conditions as a result of the infection. Unfortunately, one actually passed away. We don't want to see that happen, because losing such a life in a family is a very sad and horrific experience. The best protection, according to experts who unanimously agreed in my panel, that vaccination is the best way to protect people from their disease getting into serious condition or death condition. So I urge everyone to get vaccinated. The purpose of vaccination is to protect the children from getting into dire situations which we don't want them to see. And it is important that people know the importance of vaccination. If anybody who has medical reasons that they cannot get the vaccination, then of course it will be accepted, but we should very objectively and scientifically look at the evidence. All the evidence has indicated that the best protection from getting serious or even getting dire is to get vaccination. And I've got unanimous agreement in the panel of experts. So we should all go for vaccination ASAP and don't wait. That's the best way to protect our children.
時間關係
Now, because of the time, let's take the last question. The reporter in the front. Good morning, Chief Executive. I'm from TVB. Now, concerning the reverse quarantine discussion with Shenzhen, what is the progress? Now, there are views that our vaccination rate is on the low side. You said that you would appeal to the public to get vaccinated. Now, the suggestion is that the government should adopt mandatory measures to get people vaccinated. So would you consider that? And also, private doctors are suspected to issue jab exemption certificates without due course. So do we have enough regulations or regulatory measures on the situation? Now, concerning the discussion of reverse quarantine with the counterparts in Shenzhen, it is in progress. So we have set down important agenda items which we think are very important, including the standard for PCR test, how we can implement a closed-loop management to allow people who have completed reverse quarantine in Hong Kong to go across the border to the mainland without the 7+3 quarantine measures, as well as the manpower needed and the alignment of our measures. We have laid down several items, and the discussion is in progress. Now, please understand that this is a new arrangement. There are different issues to overcome. And in terms of the operation, the mainland has to consider the anti-epidemic measures, and also in Hong Kong we have 10,000 cases per day. So it takes time for us to explore the arrangements of reverse quarantine. And concerning vaccination, at present, our objective is to make the public aware that vaccination is important in terms of protecting yourself. And also, we want to let people know vaccination would not affect your daily life, and it would even be convenient if you are vaccinated. Without vaccination, you will not be able to enjoy the convenience. So this is our goal. At present, the vaccination rate is not very satisfactory, but it is improving. So we hope that the media friends will help us to spread the positive message. Now, we all have the responsibility to clarify untrue facts about vaccination. Thirdly, some doctors are suspected to have indiscriminately issued vaccine exemption certificates to people. Now, the issuance or using a false instrument is a serious offense, liable to a maximum imprisonment terms of 14 years. So please don't break the law. Now, if any doctor are suspected to have committed professional misconduct, we would refer the case to the medical council for investigation, and they will be held accountable. So we would enforce the law, and we hope the public would comply with our anti-epidemic measures fully. Now, with better control over the epidemic situation, it will definitely help me to balance the public health risks and the resumption of economic activities. Thank you.